You don't understand this problem at all. The distinction that you're making between urgent and non-urgent is missing the whole point. I listened to Dr. Martin Dáil talking on radio the other morning, where he made the distinction between urgent and non-urgent. Urgent is where a GP concludes that somebody is already sick. They have to be seen immediately. Non-urgent is where a GP is concerned that there are some symptoms that need to be checked out. Susie Long was non-urgent. That's why she waited 7 months. She's now dead. And last October, I raised her case here with you at the request of her family. And what they were concerned about was that no other patient would have to suffer as she suffered and as her family suffered. That a test that in any decent health service would be available within a matter of days or certainly weeks took her 7 months. Now we have reports that people are waiting up to 18 months for a colonoscopy because they're non-urgent. You say they're non-urgent. I mean, you make it sound like it's some kind of a cosmetic procedure that they're looking for. These are people that doctors have concluded that they need to be checked out and they have to wait 18 months. As you wandered around Europe last week, Taoiseach, and in all of your visits to various European capitals, have you found any other country in Europe where people have to wait 18 months for a cancer test? Our service is a disgrace. Your Minister for Health describes it as not acceptable that people should have to wait that length of time for a cancer test. It's not acceptable either to have a Minister for Health presiding over that kind of system, and not acceptable that a government that has been in office now for almost 11 years has allowed this to happen. And even when somebody gets a cancer test, they have no guarantee that the test is going to turn out to be accurate. And we're now waiting for, 7 reports on the various inaccuracies that there have been in cancer tests that we know about in Portlaoise, in Cork, and Galway, and Limerick and other centres. And this week we find an attempt at covering it up. The Examiner, for example, refers to, in an article this week, quotes from emails, which has been sent by emails between your current government press secretary and your former government press secretary. And I quote from it. It says, in consultation with the Department of Health and Children, it was decided not to go into detail in relation to the number of patients involved. Doing so would only serve to cause widespread alarm in the public and unnecessary confusion in the media. They were talking there about the cases, or how many patients had been seen by the Finnish consultant who has now been, whose contract has been terminated, who was employed in Cork.
We're well over time, Deputy.
So, can you answer me the question? Have you found anywhere where you wait 18 months or more for a cancer test? Well, again, the Taoiseach makes it sound as though the consultants are out there organising queues. One line for the urgent and another line for the non-urgent. The reason that people are being designated as urgent is because there's an 18-month queue in the first place. And they clearly have to do something with people that they've already concluded are ill. Taoiseach, if you or I went to the doctor, and the doctor recommended that we go and get a colonoscopy, you or I wouldn't wait 18 months to get it done. And I don't see why you and your government should expect people who don't have the money to pay for the service to wait for it either. Just because somebody is not well enough off to be able to go into a private facility and pay for a test, or they're not well enough off to have the level of insurance that will give them that test quickly, doesn't mean that they should be put at greater risk of dying, which is what is happening in this country. You have not been able to tell me of a single country in Europe that has a longer waiting list for these tests than does this country. You are the first out of the traps, and have been, to claim credit for everything good that has happened in this country for the past 10 or 11 years. You refuse to take responsibility for things that are going wrong, and you specifically refuse to take responsibility for what is happening in the health service. And every time you're asked a question about it, you'll find a consultant, or you'll find a doctor, or you'll find an administrator somewhere that you'll ask to carry the can. Now, Susie Long was very clear about who was responsible when she told the Joe Duffy programme that she blamed the government. And frankly, so do I. Now, can I ask you again to explain these emails that have been passing between your government press secretary and his predecessor about covering up what happened in Cork, because that's what this is about. Not telling the people, not telling the public how many patients were involved with this consultant in Cork. And can you now tell the House how many patients were involved? What were they trying to cover up here when they say that they don't want to go into detail in relation to the number of patients involved? Can you tell us the number of patients who were involved?